I'm Paul Bergh. I'm one of the founding partners of Reproductive Medicine Associates of New Jersey. I've been here since the very beginning. Well, it was kind of an accident. I actually went into radiology following med school. I was a radiology resident, and at the time, this field was relatively new, so the radiologists were doing the procedures for the reproductive endocrinologists. So we were actually doing ultrasound scans, we were doing HSGs, we were doing all the imaging for this new field of reproductive endocrinology. And I was just fascinated by it. I thought it was great. So I, as a radiology resident, got a couple of reproductive endocrinology books and started reading up on it and decided to switch over to this. I went to Rutgers College here in New Brunswick, and I spent 3 years at Rutgers College. I actually applied to med school after my second year, kind of on a whim to see if I would get in, and I did. So I'm technically a college dropout. They keep sending me, they stopped at this point, but they kept sending me letters, why did you drop out when you're doing so well? Went to med school and then decided to go into radiology. Did a transitional year and then did a year of radiology, decided it was a mistake and went back in to do OB. Did OBGYN for 4 years and then moved into Manhattan where I did my fellowship and stayed on as a clinical assistant professor for a couple of years. You know, in high school and college, I used to play soccer and row crew and run track, but I don't do those things anymore. I do, you know, I go sailing, I go fly fishing. I'm a big biker. I just finished Shantaram, which is was a great book about India, and I'm currently reading Ken Follett's book. I played the same CD for about 10 years. It's funny, a patient came in for an embryo transfer who was an old patient, had a child with us, came back a couple of years later to have another embryo transfer, and she said to me, God, Dr. Bergh, that's amazing. That same song was playing 4 years ago when I was here having my last kid. I said, it's the same CD. You know, I think the most common question that patients have is the one they don't ask, and that's, am I ever going to get pregnant? I think they all have that worry and that concern, but they never really vocalize it. Well, I think they're scared of the answer. And I think that when you approach this, you see this tunnel and you just don't see any light at the end, and you don't know how long it's going to be before you get there. And so I think our job is to give them perspective and give them an understanding that, yeah, they'll get there, that we'll help them get there. And almost everyone does make it to the light. They should have high expectations. I mean, this field has changed dramatically. People take for granted where we've come. I mean, when I started here, the best pregnancy rates in the world were 20%. That was the best in the world. If you had a male factor problem, you did donor sperm. There was no treatment for you. There's no such thing as genetic testing. I mean, we have changed so much in the past 20 years. People come in here with the expectation they are going to get pregnant and get pregnant quickly, and quite frankly, they do. Our best patients will be in and out of here within several months, which is great for the patients. But back in the old day, we really got to know our patients well because they would spend a good year with us before we were lucky enough to get them pregnant. But now most patients come through fairly quickly. Well, you know, I think the big drive is to get to the goal of one embryo, one baby. We've been struggling with that for many years, and we're actually getting very close. You know, with our comprehensive chromosome screening and evaluating embryos and selecting the right embryo, we're getting so close to getting one embryo, one baby. It's not 100% yet, but it's getting there. It's getting really close. And so that's really the goal, is for one patient to come in, put one embryo back, and have them take home one healthy child. RMA was born at Saint Barnabas. It was, I was actually the first physician as part of RMA, and then Dr. Scott and Dr. Jews joined me there. We worked for the hospital as hospital employees. And we decided that we had our own vision of how things should look and what we wanted to do, and we didn't think we could do it within a hospital framework, and so we decided to venture away from the hospital and open up what we now know as RMA. And we all sat around together and talked about it, and we all decided that, you know, we just want to be the very best there is out there. We don't want anything to get in the way. We don't want any bureaucracy to get in the way. We want to do what we want to do, not ask permission from administrators, but do what we think is best for our patients. And we thought that if we did that, everything else would follow. And I think it was a good business model. October '99, that was a little scary. We were looking to leave the hospital, and we went around looking for financing to help set RMA up, and nobody would give us any money because we didn't have any patients. The hospital owned the patients. It was a hospital's practice, so nobody really took it seriously except one banker who was an ex-patient of mine, who pulled some strings for us, and we managed to get a loan and set up our shop here in Morristown to start. And the first day we opened up, that first month, I think we had over 1,000 patients come. The patients all followed us. The patients followed their doctors because they knew we would take good care of them, and we did. RMA is really a unique collection of highly talented individuals from all different areas. I mean, not just the big name research and clinical people, but we have excellence in every single area that we do here, from patient services to finance, to accounting, to marketing. Our physicians, our nurses, our researchers are unparalleled, and that team, bringing that team together really makes a difference. Really brings a step above anything else out there.